about the university hospitals charging GST. As we know, all the private hospitals and clinics registered under the Private Facilities, Healthcare Facilities and Services Act, PHFSA, are exempted from the GST implemented nationwide last week. Unfortunately, the teaching hospitals of the universities, including the PPUM, Pusat Perubatan, Universiti Malaya, PPUKM, Pusat Perubatan, Universiti UKM, and Hospital USM, are not exempted, and the patients treated there will be taxed at the standard rate. People have sent me the photos that I printed out for you that show pelaksanaan GST PPUKM and explain Jabatan Custom Diraja Malaysia tidak memberikan pengecualian pengenaan GST kepada hospital pengajar, sama seperti Pusat Perubatan UM dan Universiti Sains Malaysia HUSM. It is inconsistent of the government to tax the poor patients at teaching hospitals. The teaching hospitals are funded by the government under the Ministry of Education and considered part of the public services. The government's hospitals are not only exempted from the GST, they are able to claim back the GST that they pay on the equipment, consumables, and services that they purchase. Most of the patients treated in the teaching hospitals are similarly from the lower income groups. They are just like the GH. And it is unfair to expect them to fork out more compared to a GH patients. This is especially the case for the HUSM based in Kebangsaan in Kelantan, whereas PPUKM and PPUM are based in KL and the living standard is higher. The Vice Chancellor, Professor Dr. Omar Osman, was reported in the New Street Times that HUSM has no plans to implement GST, and he's hoping that the government will give HUSM exemptions as an institution of higher education. As we know, the public universities are also exempted from GST. So all the government hospitals, the public universities, the private hospitals and private universities are all exempted from GST. So it's extremely unreasonable to expect the teaching hospitals to be charged at the standard rate. So I hereby urge the Ministry of Education and the Royal Malaysia Customs to exempt the university teaching hospitals from GST, both as an institution of healthcare and education for the good of the public.